as a next phase, because here's a picture of him just a couple of weeks ago. He's regained the weight because he's still hungry. You know, it's gotten to the point where the American Academy of Pediatrics is so desperate, and they're desperate and uninformed and unkind, really, that they just came out with a recommendation that we can start giving our obese children at age 12 these GLP-1 agonists, you know, Ozempic shots after the age of 12. It's okay. And we can put them through gastric bypass surgeries, bariatric surgeries after the age of 13. What is going on here? You know, in the first place, you know, we were not protecting our children because we allow them, 70% of them are obese and the other 20% are overweight. But we're not protecting our children. And then we allow the drug companies and the surgical companies and the surgical doctors to get involved in treating a problem that is caused by eating the rich Western diet and is easily solved by giving proper, current information to the public. What are we? Civilized people take care of their children. We're not doing that. All right, so let's solve the problem. The problem is the food. The problem is we're putting the wrong kind of food in the stomach. Other animals don't have this problem. You know, they are just drawn to and somehow eat their natural diet, and there's no obesity among elephants or hippopotamuses or giraffes or monkeys or alligators or snakes, frogs, you name it. No obese ones, none, period, never. And they're never hungry, or they shouldn't be. Now, how about people? You know, some of us believe that the human creation is the best of all. You know, I certainly have my doubts lately, but whatever you want to believe. And don't you think that we should be designed so that when we answer our natural hunger drive, we don't make ourselves sick and obese? I think so. I think the human body is right. Maybe it's the problem we do with the animals that causes them to be obese. When we start feeding them table scraps. What happens? This animal abuse, you see it all the time in your own pets or your neighbor's pets. They feed them table scraps, they become pudgy. That's not their diet. That's why they're obese, but they're never hungry. We've known forever that rich foods make people sick. A portrait of King Henry VIII from England. It's well known that populations, or it has been in the past, populations of people where there's affluency, there's a lot of diseases related to the Western diet, obesity, heart disease, cancers, etc. That's pretty clear. And it's also clear that less developed, less privileged societies, they still live on a starch-based diet with fruits and vegetables primarily. They don't have an obesity problem. That's so rapidly changing, folks. You need to take a look now because the world is changing. In the last 40 years, the World Health Organization has come out and says the world is dealing more with problems of overnutrition than undernutrition. In China, it was reported in 2013 in the Journal of the American Medical Association. In China, there was no obesity, no type 2 diabetes before 1980. And they lived on a rice-based diet. 90% of the diet came from white rice. And no one was overweight. You know this from various Asian communities that you've taken a look at. But with the modernization, the wealth building that has occurred in China, they can now afford to eat the rich Western diet. And now, in the year 2013, it's worse now, 10 years later. 12% of the population is frankly diabetic, and half of the people are pre-diabetic. We see this over and over and over again. It's such a part of our society and culture that we don't even apologize for it. We name some of the dens of iniquity, some of the sources of our disease. We name it after royalty, Imperial Margarines, Dairy Queen, Burger King. But the aristocrats are never hungry. This is the food of kings and queens that essentially locks you into being obese. You know, you think this is the way people eat when you go into the restaurant and you see this being served at the top of the menu and being promoted. You think you're supposed to eat this, and because it's so low in satisfying carbohydrates, except for the sugar, you're able to eat it. You don't ever get satisfied. You just keep eating. And common fare are things like IHOP serves you a stack of cheese-filled pancakes at 1,360 calories. A woman may burn 1,400 calories a day. A man, 2,200 calories a day. Sedentary, not active. Your whole day's calorie intake in one meal, basically. Taco Bell, they give you a cravings in a box meal, which has 1,150 calories, mostly fat. Pizza Hut, I know, you're like me. You didn't eat just one slice of pizza, you ate 4 slices. And 4 slices of pizza is 1,240 calories. The McDonald's, their newest offering to the public is the land, sea, and air burger. You know what they're talking about, don't you? Land, cow, sea, fish, air, poultry. Yeah. 1,330 calories. What chance do you have? Because you're hungry. This is what is available. A diet that was once reserved for kings and queens and overweight aristocrats. It's not the diet of the human being. Look what it's done to us. Let's talk about the diet that I recommend and why. And by the way, this diet is free on our website. No gimmicks. Tells you exactly what to do. But we also teach it. We taught it at a hospital for 16 years at St. Helena Hospital. We taught it at a resort for 18 years. And now it's run by telemedicine. And, if you are ready to get your life in order, to reduce your medications, to feel great, get the problem solved, stop fighting the battle of the bulge, we can help you do it in 12 days. Very, very reasonable program. Teach it all around the world. One of the first things in terms of obesity that you need to understand about the McDougall program, the foods that I feed people, which are starches, vegetables, and fruits, is that these foods satisfy the hunger drive first by filling the stomach. If you look at the stomach filling that occurs in these beakers, which represent the size of your stomach, you see that you're just filling the bottom if you do it with margarine or butter or salad dressing or corn oil or olive oil. Just a little drip at the bottom is all, 500 calories. If you go on to cheese and meat, you fill about a quarter or a third of the stomach to reach 500 calories. And then you move on to rice, you almost fill the whole stomach with 500 calories. In corn, you fill the whole stomach. And I couldn't fit in 500 calories of potatoes into my beaker-sized stomach. No room. So the first thing you have to understand is calorie density and calorie dilution. The Western diet is calorie dense. So you're taking a tremendous amount of calories when you eat. And a starch-based diet is calorie dilute. Some people get confused when I talk about our diet. They say, well, I learned that starches were 4 calories per gram. What you learned is that table sugar is 4 calories per gram. Table sugar, white sugar that sits in cubes on the table, that's 4 calories per gram. But when we're talking about starches, we're talking about that sugar mixed up in fibers and waters and phytates and proteins and all kinds of things to turn into a grain like rice or corn or potatoes. So that dilutes it down to about 1 calorie per gram. If you're going to refine your grains, you're going to bump them up to about 2 calories per gram. And that's why we encourage people who want to lose a lot of weight rapidly to stay away from refined foods because they increase their calorie density from, say, wheat berries at 1 calorie per gram. They become 2 calories per gram by grinding them up. Okay, so filling the stomach, that's first. And the primary effect, the one that satisfies your hunger drive for hours after you eat, is the one that occurs systemically. The first one we talked about was a local effect. This is a systemic effect. This creates satisfaction throughout the body. And what I showed you earlier in this presentation, that it was sugar, carbohydrate. We were talking about starches. They're what satisfies the hunger drive. It's carbohydrate that does it. And so look at the calories of carbohydrate in various foods. Butter, margarine, oil, no carbohydrate at all for satisfaction. Meat and cheese, no carbohydrate at all. Whereas your grains and your underground storage origins, your potatoes, et cetera, they're loaded with appetite-satisfying carbohydrate. So this is what happens, is you eat and you're still hungry because you ate foods that don't satisfy the appetite. And you think there's something wrong with you. You say to yourself, look, I just ate and I'm still hungry. I must be an obsessive compulsive overeater. I have a psychiatric problem. I need to go to the psychiatrist. The psychiatrist will tell me I have an eating disorder. You know, ladies and gentlemen, you may have a lot of emotional and mental problems, but your relationship with food is not such. The problem is you haven't eaten what satisfies the hunger drive. You know, I remember the way it was when I ate the typical American diet. I would eat a plate of meat and dairy and oil. And I'd immediately go, I wouldn't even think about it, I'd immediately go back for a second plate because I knew I had to have it. And I would chew and swallow. And after the second plate, you know, I got some idea that I was eating. It felt a little bit mechanically full, but I wasn't satisfied. I went and got back a third plate of carbohydrate deficient foods. I chewed and swallowed. Now I got my signals that it was time to stop eating. I was now overstuffed and in pain, but I was still ravenously hungry. If I could have stuffed one more pork chop in, I would have done it. So if you wonder why you get up from the dinner table and you walk past the candy machine and it draws you like a drug addict would, you now understand. A hungry person only thinks of food. In the process of being hungry and overeating in terms of the calories you need, you're taking a lot of fat. And the fat you eat's the fat you wear. 100% of the calories of butter, butter, oil, salad dressings are fat. Olive oil, 100% fat. Cheese and meat, 60 to 70% fat. Your grains, about 5% fat, 8% fat. And your potatoes are 1% fat, but enough fat to supply all your needs. And the fat you eat's the fat you wear. It just moves from your fork and spoon.